Mental health, rehabilitation, and pain management are some of the topics we will discuss with Dr. Vest, CEO of Global Neurosciences Institute. It's all here on the next Latino Motion. Join us.
Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation. Join us online at www.latinomotion.tv. Find us on Facebook and YouTube. We encourage your comments and contributions for show topics. Funding for Latino Motion is provided by AtlantiCare. For more information, call 1-888-569-1000 or visit atlanticare.org. Atlantic City Electric, energy for a changing world. And South Jersey Gas.
Welcome to Latino Motion, a weekly interview show highlighting issues impacting New Jersey's Latino community while advancing understanding of Latino cultural heritage and contributions to our society. And here is your host, Bert Lopez.
Buenos dias and welcome to Latino Motion. Neurosciences plays a critical role in healthcare, and joining us today to discuss how is Dr. Vest. He is President and CEO of Global Neurosciences Institute. Dr. Vest, welcome to Latino Motion.
Thank you, Bert. Thanks for having me.
So neurosciences, if you could put that in layman's term, what exactly is that field and what it covers?
That's a great question, and it's changed over the years, and a lot of physicians sometimes get confused because there's so many subsets. So neurosciences really is anything and everything that has to do with the brain, the spinal cord, our whole nervous system. And from a clinical standpoint, it's neurology, neurosurgery, psychiatry, behavioral health, pain management. All of these things fit into the neurosciences, and it's obviously a pretty vast field.
So your institute, obviously, is affiliated with AtlantiCare. Tell me a little bit about that affiliation and also a little bit about your practice.
Sure. So we're really, really proud that we're one of the first neuroscience institutes that truly functions where the doctors are all from different backgrounds, but they treat specific disease entities, so it's not siloed.
Right.
And AtlantiCare made the decision that they saw that's kind of where the future was, and there was a huge need in the community. So we partnered with them a little over a year ago in a joint venture, and we are now the sole provider for all neurosciences for the AtlantiCare health system.
So your practice is down here in South Jersey?
Yes, we're at the city campus. We are actually going to start having offices in Manahawkin and Cape May, but we are primarily in Atlantic City at the city campus.
So tell me a little bit about how the practice functions.
Yeah. So, again, as mentioned, neurosciences is one of those fields that was very siloed, and it was very confusing, not just for patients, but other physicians who wanted to refer in. A patient that maybe they're worried about Alzheimer's disease versus someone that maybe had a stroke. It's not always clear what doctor they need to go to. So we have a system where if a doctor or a patient calls and says, I need to see a doctor, this is my problem. I'm having memory, I'm having headaches issues, my back hurts. We automatically internally will get them to the right team of doctors within the same system under the same umbrella and really try to make it as seamless as possible. And the doctors can be a neurologist, can be a neurosurgeon, a pain management physician, or somebody who deals with mental health.
So on a regular basis, right, a patient will go to their primary, that's their go-to doctor. They will refer them, if there's an issue, they would refer to your practice for that specialty. Is that the way it works? Yeah,
that's the great majority of the patients, but we also welcome if a patient knows that they're having a problem that is neurologic related, there are also many times patients will just call directly and we'll get them right in.
Let's talk about some of the symptoms that people would have that are suffering from neurosciences affliction, if you will.
So, one of the big ones is stroke. Stroke is a very debilitating disease, and in the Hispanic community, there's a disparity, like many things, like obesity and diabetes. It's the fourth leading killer of Hispanic men, third leading killer of Hispanic women. And the numbers across the board in the United States, every 40 seconds, somebody has a stroke. Every 4 minutes, somebody dies of a stroke. That if anybody's having signs or symptoms of a stroke, they can come right to AtlantiCare. We're a state-designated comprehensive stroke center where they'll get immediate care.
Tell me more about that. Why is it so important to get help as quickly as possible?
Great question. Every minute during a stroke, 2 million brain cells die. So think about every minute. So time and literally seconds are critically important. And what we can do, the procedures we can do now at AtlantiCare, we can reverse those effects. We can remove clots that are blocking arteries in the brain, and patients that come in that may not be moving one side of their body, they can't speak, they can't see. If we get to them in a timely fashion, we can reverse all of that when we do our procedures.
How long is it typically to be safe to be at the hospital when you're having symptoms like a stroke?
Yeah, so every case is a little different because the vasculature in our brains, everybody's set a little differently, so to speak. But again, immediate. I mean, we tell patients, if you feel something, numbness, tingling on one side of the body, weakness, visual problems, don't question it. The sooner you get to the hospital, the better. But really within 6 hours, our group was part of a landmark study that was done in the New England Journal of Medicine called the Dawn Trial, that in certain patients, up to 24 hours of symptoms, we can reverse those effects.
Oh, really? And you mentioned the loss of brain cells. Can those cells regenerate?
Yes, because during a stroke, the brain cells are deprived of oxygen because the blood's not getting there. So they're they have some reserve, but after a certain point, they'll die. But if we can get to them during that period where they're still kind of functioning and we can restore the blood flow, we can save those cells.
Now, you mentioned immediate treatment for a stroke, obviously. What are the other type of illnesses that fall within the neurosciences, and how important is it to get a treatment for those immediately?
So anything, obviously trauma. We're also, not only are we the only comprehensive stroke center in the region, we're also the only trauma center in the region. So those spinal cord injuries, people that have falls, especially older people, but even younger people. We see it all summer with surfers. Right. Neck injuries, head injuries, closed head injuries, people hitting their head with bleeds in the brain. But everything from seizures to headaches to visual loss, there's nothing that we don't see. But the ones that are really urgent are severe headaches, worst headache of your life. That usually means there's something going on in the brain that's acute. Stroke-like symptoms, and we have something called FAST to help you remember. So face, arm weakness, speech, and then time. FAST, that's the easiest way to think about it. But anything that's usually on one side of the body, people think, oh, I'm tired, go right to the emergency room.
Yeah, that's a good point. So it's not calling the doctor, waiting for the answering machine to get back to you. You should go directly to the emergency room.
Exactly, or call 911. If you're witnessing it in a family member or spouse, call 911.
Now, treatment is obviously developing with technology. Any new research has been done to help and really advance treatment?
Yeah, another great question. So what's really exciting, especially for the community here, one of the things that we're doing that no one else in the region, including Philadelphia, is doing is once we remove the clot from the brain, and as we said that the blood flow is restored, we're injecting certain medications that help. They're called calcium channel blockers, which help reverse the effects of the cell loss. And that's a study that we've been doing for about 5 years now. And any patient that's eligible for that comes there for an acute stroke will get that treatment.
So you also do research as well in the Institute?
Absolutely, yes.
Is that something that you're also going to be doing with AtlantiCare?
Yeah, and there's an exciting partnership now with Drexel University College of Medicine, who's literally going to be building a campus here, part of AtlantiCare for medical students and other healthcare professionals. And we are part of Drexel. I'm the chair of neurosurgery at Drexel. So we do a lot of research, both basic science and clinical.
So we're going to continue this discussion. It's a very interesting topic. We're just going to take a quick break. We'll be right back with more Latino Motion. Welcome back to Latino Motion. We continue our discussion with Dr. Vess, President and CEO of Global Neurosciences Institute. And Dr. Vess, we were just talking about the meaning and definition really of neurosciences. Let's cover a little more about mental health and the impact and obviously the relationship with neuroscience.
So, again, the brain is the reason I'm interested in is it controls everything, but it's also the soul of who we are as human beings. And I always tell my patients and colleagues and students when I lecture, everyone gets depressed. You're not human if you don't. Life has challenges. And when we talk about mental health, we're talking about some of the diseases within mental health: severe depression, schizophrenia, bipolar disease, things like that. And it is very prevalent. We're seeing more and more mental health issues, especially in our younger populations. We think about what's over the last 5 years between the pandemic, and there's a lot of stressors in life right now. And the way to deal with that is not just a pill, and sometimes it's more than just talking to somebody. So you really have to holistically look at the patient. And in 2024 now, there are different modalities to treat mental health. Some of it is pharmacotherapy or medications, and that's where we work very closely with our neuropharmacy colleagues. But the goal is really finding out what the issue is, wherein lies the problem. And if a diagnosis, something like bipolar disease or manic depression, schizophrenia, things like that are diagnosed, believe it or not, there's actually some surgical treatments now. Something called deep brain stimulation. So we're able to stimulate certain areas of the brain, and we originally started doing it 50 years ago for Parkinson's disease. So someone's hand shakes, we know the pathways in the brain that we can stimulate to stop that shaking. But we also know now that there are pathways in the brain that are responsible for some of these diseases. Even recently, drugs that people are using for obesity and diabetes like Ozempic and Wegovy, we're now starting to see that they're also treating addiction, alcoholism, and other types of addictions because the brain pathways are the same. So it is really, again, getting back to neurosciences, you have to look at it at a holistic standpoint, not just giving somebody drugs and medications.
So what is the connection between psychiatry and neuroscience?
Another great question. So psychiatry, one of our missions has been to bring psychiatry, psychology, into the neurosciences because, again, they've been siloed. Right. And if you think about it from a neurosurgeon thinks, well, what do I have to do with a psychiatrist? I'm like operating on people's brains and spinal cords. And the psychiatrist, the same thing, but it is the same, it's the entire same process and the pathways of the brain. And now that there's this merger between medication, treatment of, talking to people, psychotherapy, things like that, as well as surgery, it's more critically important than ever.
Do you think that the future, it's basically more medication, or is there still a role for social workers and psychiatrists as well?
Absolutely, but it's more the diagnosis, right? Because for decades, lots of things, we treat without knowing what we're treating. We give medications to people, but we don't know what we're treating. We treat symptoms, but you have to know what the underlying problem is. And one of the exciting things with mental health now is imaging. We can do MRIs of the brain, and I can see how your brain is wired very differently than mine. You can be on an MRI, and I can start asking you questions. Some things that might upset you, some things that might make you happy. We can literally see the pathways real time. Whereas you could ask me the same questions, they might be very different because we come from, different backgrounds, different everything. Like every human's a little bit different. That's a huge game changer. So instead of going right to medications, we have a better understanding of where the problem is, and then we focus on that.
So that way you could provide the right medication, the right treatment.
That's exactly right.
Let's talk a little bit about rehabilitation, right? We talk about some of the diseases like Parkinson's, stroke, obviously that affects part of your body, but there's also has to be rehabilitation associated with that.
Right.
Tell me more.
So rehabilitation is so critically important, and it's also one of these things that has been left out, I think, of the neurosciences. And patients that have, think of spinal cord injuries, people can't walk. In the hospital, one of the things that we've implemented, and we do it now at AtlantiCare, and we have some incredible data that compares with the best centers in the country. We round every single day on every patient with our physical therapy team, our speech therapy team, the social work team. So we come up with plans real time of somebody that's had a stroke and maybe their leg is weak, and we talk together about what's the best plan for them, what is the best treatment for them, how can we work to get their muscle groups working again, and then more importantly, what happens on the outpatient end, and especially in communities like Atlantic City. That's where there's disparities start coming in, where, based on insurance, some people get great rehab when they're discharged and others don't. So we really make a point of, in the hospital, making the right recommendations so we can get people back home closer to their families, but to the right place.
Now, do you play a role as a neuroscientist in rehabilitation?
Absolutely, 100%. As a matter of fact, most of the problems with physical therapy are they're not getting the input from the physicians, and they're worried about what can I do, what shouldn't I do, when can the person be up and walking around. So we work with them and develop really unique protocols to say, let's get people out of bed day one. We're reducing problems like people getting pneumonias, clots in their legs, urinary tract infections, and things like that.
Now, if you're in a hospital, is that the role of the neuroscientist to recommend what type of rehabilitation is required?
So it's a team. So with our physical therapists, we kind of point out where the problem is in the brain, what their likelihood is, if there's any limitations, and then we discuss it, and they'll say, these are the muscle groups that aren't working well, this is what we want to start implementing, and there's no disconnect because we're all on the same page, and literally every morning we see the patients together every day.
And one of the things that just want to mention about rehabilitation, it does work.
Absolutely.
Right? It does. Is that because it's rewiring your muscles or your brain, or why does it work?
Both. Because we have muscles, but if our brain's not telling the muscles what to do and what to do appropriately, there's that disconnect. So as the brain heals, if the muscles aren't working in coordination, and you see people sometimes have strokes and their arms are like this, their hands are like this, and that's because as the brain cells heal, the muscles aren't working, no one's doing anything with them, and then they just retract and atrophy. So again, that coordination is critically important. And here's an important number that I want all your listeners to know. If you or a loved one or a family member has had a stroke, has had some type of brain injury, don't ever listen to anybody that says, 6 weeks, 2 months. 2 years. It takes up to 2 years. And that's a positive thing I tell my patients, because I say, you have all this time to get better and to heal, but it's a process that has to include physical therapy, physical activity, and direct working with your physicians.
So the patient really needs to have resiliency and be able to continue with the treatment.
Yep, and they get depressed. I mean, we talk about mental health, that's where this comes in. People, it's really debilitating to, you imagine one day you're fine and all of a sudden you can't walk, you can't talk, and it gets, it's normal. Everybody, not most people, everyone gets depressed through that. So that's where the mental health comes in, with the positivity and realistic positivity that you're going to get better, but it takes time.
Yeah, and we have more to discuss, like pain management, also talk a little bit about some disparities. We're going to be right back. We'll be right back with more Latino Motion. Welcome back to Latino Motion. We continue our discussion with Dr. Vez. He is president and CEO of Global Neuroscience Institute. And Dr. Vez, we talked about the importance of neuroscience with mental health and also rehabilitation. Let's talk a little bit more about pain management. And obviously, pain management, there's so much risk and also benefits associated with that. Tell me more about your approach in terms of pain management.
Yeah, and again, I'm so glad you're asking this as a topic because, pain management, again, fitting into the model of neurosciences is a holistic approach. Everyone's going to go through some form of pain. The most common is back pain, but whether it's joint pain, of shoulder pain, neck pain, and it's debilitating. There's a physiologic response that our bodies undergo to be in pain. It's one of the worst things. One of the number one things that brings patients in to see the doctor is pain. The problem becomes again, understanding where the pain's coming from, because almost all pain syndromes can be treated very conservatively. And again, it's a multidisciplinary approach. And the mainstay really is physical therapy, particularly in the neuro world with back pain, neck pain. More often than not, it's muscle, ligaments, tension, things like that. Even when a nerve root is being pinched, it's usually just inflamed. And so we can do injections. Our pain management team in the office can inject a little local anti-inflammatory and a little numbing medicine. And it just lets that nerve root heal, and oftentimes that's all you need. And there's some really good data that people, it's amazing to me that a lot of the docs don't talk about it, but there are multiple studies being done that show physical therapy alone with enough time will treat most pain syndromes the same as surgery, meaning you don't need surgery.
So I know this is an issue because I've seen it in my family. I've seen it in the Latino culture, so to speak here, that often, how about a medication to help me with the pain as opposed to going through a physical therapist. And there really is a lot of benefit to doing physical therapy to relieve pain.
Absolutely, 100%. And the key is, where's the pain, what type of pain is, and of course, ruling out something serious. But once that's ruled out, which is usually quick and easy to do, then it is physical therapy and usually some type of medication, which is like non-steroidal, very safe, more times than not over the counter.
And why is it so critical not to push to try to get a surgery to cure pain?
Well, first and foremost, to avoid surgery that does have risk with it. And again, I'm a surgeon, so I'm telling you that's, I make my living from surgery. Surgery is a great option and sometimes the only option for many patients. But many patients with especially initial first bouts of pain, most of them do extremely well with just conservative management. And, the risks of surgery, why undergo the risk of surgery when you don't need to?
You mentioned when we were talking about rehabilitation, it takes 2 years, to really get back. When we're talking about physical therapy for pain management, how long does that usually take?
That's usually a few weeks. I mean, it can be anywhere from 2 weeks to 6 weeks, and it depends what type of problem is. Is it a muscle, a ligament issue? And it's usually about 6 weeks. And what they do really well is get you to the point of rehabilitation, but they'll give you exercises that you do at home. Because now you realize, okay, if this pain comes back, these are the stretches I need to do. These are the types of exercises I need to do to take care of it. So it's more of an education.
Is that something you could do on your own in terms of having some sort of exercise routine that could help you, say, for your back pain, et cetera?
Not initially, because some of those types of exercises can make things worse. So you really want to be seen first and have a diagnosis and then have the physical therapist work with you. Once they see what this is, then yes, then they'll say, this is what you do if this pain returns, this is what will take care of this. And as you know, especially in the Latino culture, I mean, hot versus cold versus, there's lots of different types of philosophies. And, it's interesting because some people respond with the same type of injury to heat, where others don't, they respond to cool. So there's lots of different things that go into that.
Let's talk about the risks of pain management. Obviously, we know addiction could play a role when you are utilizing pain management the one way. Tell me about that risk.
So there's different risks. So the risks of the physical therapy, the actual physical being in a gym and doing that are very, very minimal. I mean, extremely safe. The risks of pharmacotherapy or medications, that becomes, as we know, there's an epidemic, still an ongoing epidemic. You look at what we went through with OxyContin and other types of narcotics, where it becomes very across the board, everybody, whether you're a famous billionaire or somebody, everyone can be addicted very easily. So the problem now is, I think we've gone to the extreme, where many pain medications are lifesavers for people, where they're used appropriately, they're used in the right way, they're used safely, but it has to be monitored. And that's the key where I think we lost, where people were just prescribing them without a lot of monitoring. But there is a risk there, and that's why it has to be managed very closely. And the physicians and the physical therapy team have to figure out what treatment modality is best for each patient.
What's the primary question that a patient should be asking their doctor about pain management? Really, why am I having pain? That's number one. Like, why am I having this back pain? Why is my neck hurting? And you should always get a straight answer from your doctor. If you don't, and I always tell my patients this, push the doctor. Don't be afraid of the doctor. There's especially, it's more of an age group that, oh, the doctor said it, he knows or she knows best. No, if something's not making sense, then you ask them and keep asking. But that's the number one question. Why am I having this? And then what is the treatment for it? And what are the options for treatment? Let's talk a little bit about the disparities. I know we mentioned that early on, and you highlighted some of those, and access to care, underrepresentation, and research and cultural stigmas are all part of that. Tell me more about what you've encountered in terms of the disparities.
Yeah, so our group, we're very proud of, we started off at Thomas Jefferson in the city. We were at Hahnemann for many years, which was part of Drexel. We started the neurosciences program at Capitol Health, and we're really the first to bring this level of care to New Jersey. We've always worked in areas where there are these disparities, and are very proud of that. And there are still disparities, unfortunately, across the board. But I am very, we've been here about a year, and I can tell you I'm very proud of the AtlantiCare health system. One of the reasons that we made it very clear we want to be at the city campus, we know for access, that is where people are able to go. Many people don't have the ability to get into a car. They're relied on public transportation, things like that. That's where our outpatient offices are. That's where in the ER we'll immediately, take care of anybody regardless of, their ability to pay, their background. Language barriers are really not an issue. And so there are disparities, but what I want to really make clear to your viewership is that, don't be afraid to come to the hospital.
Now, I want to end with a success story. Tell me one.
So I can tell you a recent one just from a few months ago this summer. It was actually tragic with a good ending, but there was a very young girl, 17 years old, who came here from Lithuania, came to this country in a kind of a dangerous area. Her mother sent her on a work-study program. She was working at the Maury Piers, and there was a drive-by shooting, and she got shot in the head. 17-year-old girl. Wow. Was literally in a coma when she came to us, gunshot wound through the brain. I remember this, I've been doing this almost 30 years, and these are the ones I remember. Had to call her mother in Lithuania to tell her that her 17-year-old daughter most likely was not going to survive. We took her to the operating room, and we did a 7-hour surgery, and now we were able to save her life. She did unbelievably well. She's walking. She's, again, with physical therapy, with great team of physicians in the ICU. She's home in Lithuania now and is going to be going to school in the fall. So that was, I think, a huge success story for the area, and it shows you the importance of having a trauma center close by.
One of many success stories.
Yes.
Thank you so much, Doctor, for being here on Latino Motion, and thank you for joining us once again at home here on Latino Motion.